Good evening, medical terminology students. This is Brother Packard. Just wanted to get in touch with all of you and see how this week is going. I just wanted to bring up the pronunciation of some of the words in this chapter in the digestive system. I've had some questions about some pronunciations, and I wanted to bring up a few examples. First of all, I wanted to show you these three suffixes that you will see very often in medical terminology. You'll see them in pretty much all the chapters we're going to be dealing with. First of all, there is the suffix tomi, there's the suffix scopi, and also stomi. Now, the reason I bring these suffixes up is that when you combine them with the medical terminology words, they change pronunciations. For example, with tomi, if I was to make a hole in the stomach, or make an incision into the stomach, that would be a gastrotomy, not a gastrotomy. Okay? With scopi, if I wanted to use an instrument to look into the intestines, I would perform an endoscopy, not an endoscopy. Okay? And same with stomi. If I wanted to create a hole, say in the esophagus, that would be an esophagostomy. There we go. Even I have trouble pronouncing some of those big words. So just wanted to remind you of those and just bring up those examples of how they change the pronunciations. Those suffixes will do that with just about every word they're combined with. Just looking at the chapter here, there are a few difficult words, and I just wanted to go over some of those pronunciations with you, just so that you're clear on how to say them. For example, in the chapter there is proctosigmoidoscopy, another scopy word. Also there is a gastroscopy is in there as well. An anastomosis, and that is where you join two anatomical structures together. Okay, so remember that word. It's kind of a hard one to read. Anastomosis. There are also antiemetics, which are medications that help prevent or eliminate vomiting. Other words that might be a little difficult: leukoplakia, steatorrhea, hematemesis. Okay, and anything where you see emesis, you think vomit. So hematemesis is when you are vomiting blood. Now, dysphagia is another one. Okay, dysphagia is a word that speech therapists will use very often. And when you look at it, it's difficult to pronounce. So just remember dysphagia, dysphagia. What it means is that a patient may have difficulty talking. That condition is called dysphagia. In other words that might be difficult to pronounce or understand, let's see if there's any other ones that are really standing out right now. I know in this chapter there are a lot of different medications and laboratory tests to remember. It looks like that might be most of them here. Most of the more difficult words to really understand or pronounce. Halitosis, foul-smelling breath. Cirrhosis, which is a condition of the liver, usually caused by alcoholism. So for now, if there are any other words you have difficulty pronouncing, or if you have any other questions, feel free to let me know. I will have start having an office hour Wednesdays at 6:30 p.m. Mountain Standard Time. So feel free to jump on to my Zoom page and ask any questions you like, and I'll do my best to help you review for the chapter that week. Other than that, let me know if you have any other questions, and have a good evening.